My name is Colleen Reynolds. I am a media relations coordinator for OSF, and I support OSF On-Call Digital Health and OSF Innovation, two branches of OSF Healthcare that have been heavily involved in this project. It's a super exciting time. I'm very excited because I'm really the target demo for this unique new model of care. I am over 55 and I have 2 or more chronic conditions, and I can really see how this is going to really help people like me manage their health better. So it's super exciting. And I know another woman who had so much to do with the planning and the community input and feedback into this clinic, and that is Kathleen Kinsella, who is the president of OSF Little Company of Mary Medical Center, and she's going to be telling you a little bit more about the details of this exciting new model of care.
Thank you, Colleen, and thank you all for joining us today to celebrate the construction of this new clinic, which will house the new innovative model of primary care for those 55 and over. For over 95 years, Little Company of Mary Medical Center has been providing compassionate and high-quality care that you have come to count on. OSF Healthcare, through OSF On Call, is dedicated to developing new and innovative ways to provide accessible care to the community, meeting our patients, our neighbors, our friends, and our loved ones at every step of their healthcare journey. It is the combination of these core foundations that allows us to bring this new model of primary care to you today. This program recognizes that life is busy. As the seasons of life change and the years move forward, we may find ourselves taking care of our kids, our grandkids, our spouses, or other loved ones, all while trying to maintain our own health along the way. Many people 55 plus are beginning to not only manage their loved ones' chronic conditions, but their own as well. Chronic conditions such as diabetes, heart problems, arthritis, and often more than one at a time. For people in this phase of their life, OSF is excited to bring a new, proactive approach that gives patients multiple opportunities to access treatment and support. While this building may be the physical location, this primary care program will extend well beyond these walls by incorporating a mix of virtual care, digital health monitoring tools, and 24/7 access to your care team. We will continue to offer our traditional model of primary care services in the community, but now people will have more options for where and how they access their health care.
Little Company of Mary, OSF, is out here today in Evergreen Park. We're at the corner of 99th and Western Avenue. I heard you guys were doing construction, and I thought to myself, well, it's just a bigger part of the campus down there. And instead, you're expanding to all these little areas all over the south side, and Evergreen Park gets a new location that we're going to talk about today. And I have the president of OSF here with me right now. Her name is Kathleen Kinsella, and then I have Kate Barth with me. VP Nursing is what I think I heard there as well.
Yes.
And is this your baby? It sounded like you're the president, but you kind of take the reins on this whole thing, correct?
So I will be operationally responsible for this new model of care that it will be going up in Evergreen Park.
And it sounds like it's for mainly 55 and older. Can you describe to me what that's all about? You're targeting a specific age range that is running into chronic illnesses and may have more than one, and they need to be constantly checked on.
Yeah, so our focus, we realize that there's a growing population of 55 plus age group across the community, and we recognize that they really need a different care model. They need really to be able to choose their care options as they are aging, and they're often caring for their children, their grandchildren, sometimes their elderly parents, and they're likely still working themselves, so life is busy. So our goal is to find the care that they need and create easy to access options, whether that be virtually, whether that be through extended clinic hours, or whether that be in their home.
So one of the things that I've noticed, just as somebody who's now 47 years old, I have one kid that just went off to college, so we're keeping track of where she gets her health care at the University of Illinois. I got a high school kid. I got a little guy. I got parents that are aging. Pretty soon, it sounds like I'll be in this group that you're looking to service. I'm noticing that it's a little different these days than it used to be when it comes to healthcare. Instead of just a general practitioner, and then you go to the emergency room when something bad happens, or they send you to the hospital, there are more clinics. There are more setups like these. Is this the new way of medicine, and how has this changed in the last 10 years or so?
So healthcare is certainly evolving, and along the way there have been new models of care that are developed and new opportunities, such as telehealth, right? People use telehealth services today, but sometimes they're not integrated. So it's not always connected to your primary provider. Our goal through this model of care is really to integrate that into our electronic medical record system so that the primary care physician can ongoing care for that patient or the loved one across the care continuum, whether that be from the ER at the hospital to the clinic and in their home. We want it to be one seamless journey for them. So we'll have a care navigator on our team that helps to navigate those transitions so that takes that weight off of that person, where they can just take care of themselves and we can give them their medical needs in their journey.
Kathleen, you're the president of OSF. You've got this growing set of facilities. I mean, it seems like every time I drive around now on the south side, there's another OSF care station, or there's just so much. I see the letters up on the side of so many buildings right now. You continuously seem to be expanding. What has that expansion been like for you over the last few years?
Well, it's been very exciting, but it's also been our way of making sure we're staying connected to the communities we serve. We know that OSF Healthcare isn't just at 95th in California. That's clearly our anchor hospital, but as you heard us talk about today, we know we need to meet people where they are in their healthcare journey, whether that's the hospital or the ER, but hopefully preventing that and maybe coming to a physical clinic, whether it's this new model of care or a traditional model of primary care, as well as though this model actually offers people who will come to your home if you need that. And there's all kinds of virtual platforms that they can help with. Monitoring your blood pressure from home, monitoring your weight, which is important if you're having a chronic heart condition, things along those lines. So I think I would like everyone to know that OSF Healthcare should be their provider of choice for all the communities we serve, and we're certainly making investment and dedication to doing that.
Well, the thing I like the best about this is that it sounds like I have a problem, all of a sudden I'm with you, you're keeping track of me. Because I'm an idiot. I don't keep track of anything that's going on with me. I mean, it's funny, but I mean, like I know what all my ailments are, but I don't remember them all the time. I had to call a doctor the other day, and I said, am I due for, and I won't get into what test it was. He was like, yo, you did that. You don't need to do that again for another 5 years. I don't remember these things. It sounds like what you guys are going to be doing is reminding people and then telling them this is the building you go to today. This is where you go and you get this done, and it's a little bit more convenient.
I think one of the key components of this program is the health navigator, as Kate spoke about. A healthcare system, working in healthcare can be complex for some people. And so having someone who can help you along that way, not everyone speaks healthcare as well as others. And so it's not only having everything in one medical record, but it's having someone help you make some of those decisions or help guide you in getting things organized. Kate, did you want to speak to that?
Yeah, so we know that telehealth can be challenging. Having people go to the homes to help people work through that so that they're comfortable accessing that care. Or we also know that insurance can be challenging, right? When you have medications that you have to take for a chronic condition and your insurance requires prior authorization, it's hard to know that you can't just go pick it up. So having someone on the care team that can navigate that and help talk through where it's at in that process and when you can go pick it up is really, we want to ease the way, and we want to close those care gaps for our community and those in our community to make sure that they age well and to make sure that they truly can live a fuller, happier life and be active.
How soon until this facility opens up? Like, what's the target date? I don't want to pin you down and then it isn't open on time and then you're like, oh no. But I mean, like, what are we looking at here?
Sure. So construction is hoping to wrap up at the end of December.
They're doing it
So
right now behind us. Which
They
is great.
are.
Yeah.
They are.
They did not
well on
stop
their
for this
way.
event. They're like, we're going to keep going. I don't know what you people are doing, but I got to put up a beam.
Yes. So there at the start of the year, we will look to ensure that we have the right care team in place so that we can start the care in the community.
That's awesome. And now, how do I know that I'm right for this place? Like, as I've said this, I've spoken with some of your doctors before, and I'm like, how do I know when I go to an urgent care instead of going to an emergency room visit or going and seeing my regular doctor? Like, how do I know when it's time to come here? What would your advice?
So for anybody looking for a primary care provider or who may not have a provider currently that's looking to better manage their health overall, 55 plus is our target, but certainly just want to make sure that we have the care they need in the community. So if on that journey, we would love to help, and they can just reach out and we will get them engaged into the system.
Awesome. Kate Barth, Kathleen Kinsella, thank you so much for joining us and for telling me a little bit about this. We're looking forward to seeing it coming in very soon at 99th and Western. Thank you.
Thank you so much.
Thank you.
It's the EP Podcast. All things Evergreen Park. It's the EP Podcast. Evergreen Park.